So we live in a place in which in which health is constantly talked about. We live in a society where you always go and see a billboard or a commercial, always stressing like exercise, eating healthy, and all of this. But something that tends to fall behind is the actual like mental health, because mental health is actually part of health. It's just a part that tends to be left behind. And something that could be the reason for this is the stigma that arises with mental health, or it goes much deeper into the lack of mental health education and services being provided in our community, the United States, or even like the surrounding like world. So for this project, I decided to look at the lack of mental health education and services. So I started this process by researching mental health education and services to try to like figure out where exactly does the current problem lie. And with my research, I found that it's due to the lack of funding for services, and that could possibly due to that the demand for these services is so high, but the supply is just not there due to funding, and that also extends out to like different socioeconomic areas, and how there's some areas where they just don't have the funding to provide services for those people in that community. It's also can be contributed to schools and educators not being prepared enough to recognize mental health symptoms in students, and that could just also be to the people just see teenagers as being teenagers. And as like we've learned, and especially being a nursing student, teenagers being teenagers is almost like a cop-out to kind of just like shun that like mental health stuff away, or just like avoid the problem, when in fact when teenagers are just being teenagers might in fact have some signs in which mental health needs to be addressed. So I took this a step further, and I went and did some research with interviewing nurses, counselors, and people who work in this field. So the first person I interviewed was Dr. Harper. She's a psychology professor here at Queens, and she actually owns her own kind of clinic in which she sees people for mental health related problems. So with talking with her, she definitely believed that mental health is an issue that definitely needs to be addressed. She talked about how often she has clients who, if they're in crisis, she can refer them to go to different hospitals or places, but the problem lies in that there isn't space to treat these people, and also insurance is a common issue with that. And she said the reason why maybe other countries don't have as much of a problem with like space or like kind of the whole insurance issue is because a lot of other countries, especially in Europe, have that universal healthcare system, in which the US doesn't have. We have insurance companies in which often they don't pay for different mental health conditions that people may have. So she talked about how she did a JBIB to England a couple years ago, and they talked with people there in which they were like, why does the US not have universal health care? Like, universal health care, it's great, like everyone can like go and seek out like what they need, and it includes a lot of mental health things as well. And she said that's maybe something we can take from other countries, or try to incorporate little bits and pieces of that to try to maybe get insurance companies to get on board for certain mental health education or mental health problems, so that people can get their meds, people can go to counseling services, so that they can get the help that they need. So taking it back from that global kind of universal healthcare thing to things in Charlotte, she said that there are a lot of places in Charlotte that provide mental health like services, but a lot of people they don't seek out the information, or they aren't informed just to people not talking about it. So she talked about how there's different organizations and things out in the community that are starting to try to work to inform parents, because she believed parents are like kind of the first people who can recognize some of these symptoms in their children. So even though yes, we might have a lack of education in our school systems, it also extends to the parents. The parents need to be educated just besides the students. So a lot of churches and schools, they will hold monthly like kind of meetings to kind of like teach parents what exactly to look out for, so that when they say teenagers just being teenagers, they can actually take that and dig a little bit deeper into it. And then extending it to what's currently being done like right in our neck of the woods at Queens. She talked about TTU. So TTU is a program here at Queens in which students basically, it's almost like mini counseling sessions for students by students. So students, especially incoming freshmen, can come and meet with a group and talk out certain problems that they might be having and trying to adapt. And with that, it can kind of like help pick out people who might need to be referred to like go to like Health and Wellness for a counseling session here or there, just so people don't feel alone or, you know, have something. And then she also talked about QPR training that Nurse Jill over at Health and Wellness has started to implement and have these days for educators and even students to come in and learn. So QPR is basically CPR, but more for your mental health and recognizing mental health issues in individuals so that you can be like a first responder in these types of situations. So she talked about that, and she said, especially with me being in nursing, it's something to look into, and I definitely think it's a good idea that I will definitely be considering to look in, because you can put it on resumes and things like that, and especially being able to recognize mental health symptoms in the community, it can definitely help out and help solve this issue. So the second person I talked to was Dr. Cornelius. She's a mental health teacher here at Queens for the nursing program, and she definitely believes that mental health has definitely risen in the past couple of years due to the fact that students nowadays have so much more pressure on them. They're constantly, you know, in order to, you just getting good grades isn't enough to get into schools or get into a particular program that you want. You know, you have to, you know, have all these extracurriculars and a 4.0 and all A's and B's to even possibly be considered. So she definitely believes that part of this mental health problem is due to just so much pressure being put on students, and that can be from society, parents, and things with that. And she believes that also that comes with that is coping mechanisms, is a lot of individuals haven't developed good enough coping mechanisms in order to deal with this extra pressure, and therefore there's this anxiety, and you know, we have depression and things like that that come into play. And she definitely believes that there needs to be better communication, and that services do exist, so that people aren't afraid to go and seek them out. And she also stated how more people, I think, now are coming out and talking about mental health, which has kind of helped students and individuals say, oh yeah, maybe I should go see someone. And that's due to like celebrities. We have, you know, she talked about Kanye West, who's come out and talked about his bipolar and things like that. So these celebrities kind of have allowed to be like kind of a role model in a positive way for students to kind of come out and talk about mental health issues, or even go seek out help and know that they're not alone. And some things that she talked about that are being done in Charlotte that she's been happy to see is that they're starting to implement mental health education programs in some schools. She doesn't live in Charlotte, but she lives in Waxhaw County, and they've started to implement this program in their public school systems that is going to kind of teach students what to recognize and things like that about mental health, and how to develop proper coping mechanisms for, you know, anxiety, depression, things like that. And hopefully with Back County like starting to implement this program, this can kind of, you know, overflow into Mecklenburg County in their public schools, to hopefully, you know, kind of help solve this problem at the root. And she also talked about taking it on a global perspective, how different countries in Europe, I think she talked about England and some other countries, how they've come up with a national healthcare system alliance, where these countries basically research mental health that's going on and what each country is doing separately, and then they come together and bring together their research to kind of share ideas and popcorn off of each other to help each country out. So something that we could possibly do is take what we've seen from other countries and bring it back into the U.S. because even though the U.S. tends to always be like, oh, we're like this great big country, we always try to tend to be ahead in all of these areas. I think maybe if we take a step back to learn from other countries and not be, I guess, the top shining star for a moment, we might be able to use what they've developed or researched to help our own country and our own community. So the last people I interviewed for this project was Nurse Jill and Diane over at Health and Wellness, and they specifically talked about what's going on at Queens in general and specifically. So they talked about how there has been an increase in counseling sessions, and they believe that is just due to Queens being they're getting rid of that stigma that has kind of been surrounded by mental health. So there has been an increase in counseling sessions, and they have seen that it does help. But they also stressed how with mental health, the students, yes, they can be educated and told to do this, that, and the other to help them, but the student themselves has to be willing to take the opportunity to be like, oh, this also involves me to actually actively try to do something to help change my mental health. So in a way, even though we're educating or trying to educate students what to do for their mental health, there's also an extra education piece that we need to educate students that they need to take an active role in their mental health. And another thing that they had talked about is how money tends to be kind of a root to the problem of lack of mental health education and services, just because it's always comes down to the question of who's going to pay for it, who's going to pay for the counseling services, who's going to pay for the education to teach and actually want to teach students. So that is some other question that arises with this entire issue. So in conclusion, mental health is definitely an issue that needs to be talked about, as even though we talk about, oh, we need to go to the gym to exercise and eat healthy, we need to also exercise our own mental health and like kind of give ourselves the like nourishment for our mental health, because mental health is also it's part of our health, and we shouldn't neglect it just to the stigma that arises around it or things like that. So definitely if we spread the word more to try to get people to recognize mental health and to not be so afraid of it, perhaps we might be able to help solve this problem.